Good morning, everybody. Welcome to this MS Views and News Wellness Summit. All right, it's the first of its kind that we're doing in the Atlanta area. The company that sponsored today's event for the in-person aspect, and for most of it, obviously online as well, is Sandoz Pharmaceuticals. Other than Sandoz being our exhibitor as our primary sponsor, though, we have exhibit sponsors. We have Alexion, Banner, Life Sciences, Genentech, Horizon, Novartis, Sandoz again, and TG Therapeutics. And we should give them all a round of applause for everything that they did, right? And this is Julie Stoll, and she is with the Shepherd Center, and she is a physical therapist. She's a licensed clinical physical therapist and the Multiple Sclerosis Research Fellow in the Andrew C. Carlos Multiple Sclerosis Rehabilitation and Wellness Program and Virginia C. Crawford Research Institute at the Shepherd Center, a top 10 nationally ranked rehabilitation hospital specializing in medical treatment, research, and rehabilitation for those with spinal cord injury, brain injury, stroke, multiple sclerosis, spine, and chronic pain. Let's welcome up Julie because she's got a bio that I could read all day. So. Thank you very much.
Thanks, everybody. All right, so I want to start with telling you that exercise is medicine. Exercise increases your physical well-being, improves your cognition, and improves your mental health. Exercise is neuroprotective. It increases connections in your brain and spinal cord. It increases the healing properties that your cells naturally do all the time. It defends your central nervous system, helping to remyelinate your neurons and heal those neurons. Exercise is the single most effective non-pharmaceutical symptomatic treatment for MS. So some objectives that I'm going to be talking about today: physical activity and health risks, the importance and benefits of exercise, using the staircase model to reach the target that's recommended for how much exercise you should do every week, different types of exercises and examples, primary concerns that we should all focus on when doing exercise, how to rate your effort, so kind of help you keep it reeled in when you're doing your exercises, the recommended guidelines, an example home exercise plan, and then of course, wellness and mindfulness, which Jessica just touched on very well, and conclusions. So physical activity, something we do all the time. But we tend to limit that when we have MS. And maybe that's because of fear related to worsening symptoms. Perhaps that's fear of falling. Or maybe you have fatigue weighing you down. The problem is that when we do less physical activity, we have deconditioning. It increases your disability and unfitness. It decreases your mobility and quality of life. It increases your instability and your gait abnormalities. It reduces your strength and your bone mass. So maybe you're thinking of other barriers besides maybe what you feel. Maybe it's physical environment where you're located. Maybe it's the social environment. Maybe you don't have the money or the support to be part of exercise. Maybe you're worried about the cost. Or mostly what I'm always worried about is how much time do I have? Is that possible to fit into my schedule? But it's really important to fit in exercise because it reduces our risks of health problems, what we call comorbidities. Okay, so what do I mean? I mean cholesterol, hypertension, diabetes, stroke, cardiovascular disease. Okay, so exercise combats those. Exercise can reverse the physiological effects of inactivity. Exercise is simply physical activity performed in a regimented fashion with the purpose of improving your physical fitness. So exercise is important because it reduces deconditioning. It does not increase your risk of relapse. Okay, so it's not going to make your symptoms worse. In fact, it's going to treat your symptoms. It's reparative. And it's going to be able to boost your immune system, meaning that it's not only healing, but it helps you feel better. It decreases the dysfunction of your blood-brain barrier. It influences remyelination of those neurons. It is protective. So let's look at some of the benefits, more specifically to symptoms that you may experience. Exercise can improve your fitness level. That's basic knowledge, right? But it can also reduce your fatigue. It can improve your fitness, improve your strength, your flexibility, your balance, your cognition, and your overall quality of life. You will be less tired. You will have more energy, and you will be in a better mood after exercising. And in addition to feeling all those wonderful things, you're also fighting brain degeneration. So what's our recommended target? It's 150 minutes. Now, most of us are like, oh my goodness, are you kidding me, 150 minutes? It seems like a lot, but when we add up all of the things that you're doing, all that physical activity you do around your home, doing the dishes, folding the laundry, putting it away, and if you can squeeze in some exercise, that's achievable in a week. When you are doing this activity, it should be low to moderate intensity, meaning that it's not too hard for you. And you want to start low. If you don't have a lot going on, start low and gradually build up. You can't jump in full steam. You must build up over time. And just like a marathon runner that trains for 20 plus weeks to reach their goal, so can you. Okay, so additionally, if you have a heart condition, please make sure that you get cleared by your medical provider before beginning an exercise routine. So what's this process in starting an exercise plan? Well, I like to use the staircase model. Very simple, we can all relate to it. We've all seen a set of stairs. Okay, so we start at the bottom with our basic range of motion. If you need help, have somebody help you move through a range of motion, like moving your arm up and down, or moving your legs, and then progress to doing that on your own if you're able to. And then use focused exercises to strengthen your muscles. Progressive resistance, meaning making it a little bit harder every time you do it. And then make those exercises more complex. We call integrated exercises that combines strength, endurance, flexibility, balance, and coordination. It's always a good idea to develop some goals. I like to use the SMART model: specific, measurable, attainable, relevant, and time-bound. So then I can progress through my steps to reach my goal. Everybody's going to have setbacks. That's normal. Regroup, take a step back or a step down on our model, refocus, and start again. Sometimes that means back at the bottom step, and that's okay. So how do we take on exercise? What types of exercise are there? How much should we be doing? Those are all questions you may be thinking. So let's start with the different types of exercise. There are 6 main types: aerobic exercise, muscle strengthening and resistance training, flexibility, balance, that includes both static and dynamic balance, coordination exercises, and respiratory training. Okay, so you don't have to be a fitness legend like Arnold Schwarzenegger to exercise. But always remember that exercise is going to be helpful to you and it's not going to make your MS worse. So let's look at some examples of each type of these, starting with aerobic exercise. Okay, so we've got an arm bike here, aquatic exercise. We've got my favorite, the recumbent cross trainer. Okay, you could also include the elliptical here. For those of you that this may not be an option, there's additional pieces of equipment called functional electrical stimulation bicycling. Okay, that's also an option. Okay, so this type of exercise should be low to moderate intensity, meaning it's not too hard to do. Whatever you decide that you want to incorporate, safety is key. So pick the safest position for you. If the elliptical makes you feel unsafe, don't do it. Pick something that is seated. All right, so let's look at muscle strengthening and resistance training. So I'm talking about body weight exercises, using resistance bands, weight machines like the leg press, free weights like basic dumbbells, kettlebells, ankle weights. Okay, so I've got a variety of exercises here to show you some examples of different exercises that fall within muscle strengthening training. Our next area is flexibility. This is one of the things that everybody can do every day. And you should do it before and after exercise. You should include both upper and lower body muscle groups. And you should target those muscles that bother you the most. Maybe they're spastic. Maybe they have spasms. Maybe they're really tight. Those are the ones you want to focus on. You want those stretches to be slow, gentle, and prolonged. Okay, so 20 to 60 seconds is a good time frame. It should be comfortable. It should not cause you pain. If it causes you pain, pull back. Don't push into that area where it hurts. Stay within a comfortable range. Don't bounce. This will cause injury. Okay, so take care of yourself as you're exercising. You can use a towel, you can use a belt like we see with this man in the right corner. You can also use a partner for assistance to help you if it's needed. Depending on your functional level, you may want to try yoga. All right, so let's now look at balance. As I said, there's two types of balance. There's static balance and dynamic balance. You see here static balance. Okay, so this woman has a wide stance on the left, moving to the right, a narrow stance, tandem stance, single leg stance. What you may not notice is that she's actually standing in a corner. Okay, this keeps you safe if you have a tendency to go backwards. Okay, if that's still not good enough for you, hold on to something like we see on the far right with this man. Okay, if you still don't feel safe, have somebody with you. Get yourself a gait belt and have a spotter. Safety is key. So let's look at dynamic balance now. This is a little bit more challenging, but it relates more to function because every time we step, we lose our balance a little bit and then regain it again. So this is how we challenge our balance so that we improve it when we are moving around. So we see this woman doing high knee pull downs, okay, working on balance while she's moving. You can also do standing and using movements of the legs while holding onto an object. You can sit on an exercise ball and march those legs, focusing on keeping that core nice and tight. Or you could touch an object with your toe. So this person's using a cup, but you could use a step, you could use a box. I know phone books don't exist anymore, but you could use one of those too. Okay, whatever you do, just make it safe. Plan to do exercises when you have the most energy. Okay, so think about your day. Oh, you've got a lot of walking, you've got to go shopping with mom or the kids. Maybe that's not the best time to do balance that's really challenging after all that. Our next type is the coordinated exercises. These are the complex ones. These ones really challenge us. Okay, so we've got bird dog, we've got squats with an exercise ball, we've got mountain climbers, lunges with an exercise ball that's weighted. You could also do that without the weighted ball. And we've got the dead bug in the bottom left corner. Okay, so these are complex movements. These really challenge us and improve our strength. The last and maybe the most important training we can do is respiratory training. So I've got 3 types of breathing training here: diaphragmatic breathing, box breathing, and pyramid breathing. So on the right, you see a guide for how to perform diaphragmatic breathing. Okay, so you can start laying down, then you can transition to a seated position if you've mastered the one laying down. Place a hand on your chest and on your stomach. Inhale through the nose and then breathe out through the mouth. Okay, so this is something that you should do regularly and often. This is going to help with that tension that may build up in your chest, may have that uncomfortable, painful squeezing feeling that we in healthcare call the MS hug. Okay, box breathing in the center, that's a count of 4 on inhalation, holding for 4 seconds, and then exhaling for 4 seconds, and holding it out for 4 seconds. This is a great tool to manage stress. In the bottom left, you'll see a pyramid, okay, and it shows how many seconds your inhale and exhale should be, starting with 4 seconds and increasing it to 8 seconds. And then you reverse that. Okay, so 4 seconds in, 4 seconds out, 5 seconds in, 5 seconds out, proceeding all the way to 8 seconds, and then back to 7, 6, 5, and 4. Breathing is wonderful, right? We got to do it. Every day, every second, we got to breathe. But when we focus on breathing, we can decrease our blood pressure. We can decrease our heart rate. We can manage stress. We can improve our immune function. We can increase calm and well-being. So 2 primary concerns that I have for you when we're exercising is safety awareness. I cannot emphasize safety enough. If you can't do something standing, do it seated. Be safe. Don't compromise your health to try to exercise. Have a spotter, use a gait belt. Have something very stable to hold on to. Okay, so if you're using a rollator, which a lot of my patients use, it should be locked so that it doesn't go anywhere if you start to wobble a little bit. The second is postural awareness. You want to make sure that your posture is good and aligned. And all of us need to do this all the time. I could work on it. Okay, so let's do this together. Align your ears over your shoulders. Have your shoulders over your hips. And if you were standing, your ankles under those hips. Tuck in that bottom just a little bit to reduce the arch in your low back. Make sure that chest is up and open to enhance your breathing. And keep those shoulders down and tucked in. So let's say you decide to start exercising, but you're kind of unsure of where to start, what exercises are correct, and what intensity you should use. Well, we can use a chart called the Rating of Perceived Exertion, or RPE for short, as a way to measure your intensity level. Okay, this is your perceived rating, not somebody watching it. It's how you feel. Okay, so where do we want to be if we have MS? Between 2 and 6. Okay, so if we look at our little table, that's light activity to moderate activity. So we're not pushing ourselves too hard. Occasionally, we may be in that vigorous activity zone, a 7 or 8, and that's okay. That happens, and it's actually appropriate in small amounts. It's very beneficial for your heart health to have occasional vigorous activity. Most of the time, staying between 2 and 6 is where we'd like to be, so we kind of manage our fatigue that can come on later in the day. So thinking back to the beginning, I told you we need about 150 minutes or more of exercise per week. And so you may be wondering how we divide up that time over all these different types of exercises that I've provided you. Okay, so we have a breakdown. Aerobic exercise should be 2 to 3 times a week, 10 to 30 minutes at that moderate intensity. Resistance, also 2 to 3 times a week. You're going to do 1 to 3 sets of that exercise, 5 to 10 exercises. Okay, so for my patients, where I try to mix it up when they come, that doesn't mean they do every single exercise I've ever given them all in one day. Don't do that. Pick 5 to 10. If 10's too much, just do 5. If you're feeling not that great, do 1. Then you can say, I did something today. Thinking about flexibility. This is something we should all do daily. Again, 30 to 60 seconds of that stretch, upper and lower body, focusing on those that bother us the most, that have the most tension, that maybe have spasms. And then we've got the neuromotor category. This is just a fancy name to kind of put those more complex movements all in one box. The coordination movements, the balance training, and the respiratory training. Okay, so spread these exercises out over a day. Do them when you feel your best. Consider how you feel and your energy level, and reel in exercise based on how you feel. And of course, everybody would benefit from having their own tailored plan. So if you're able to do that, go ahead and meet with a physical therapist so they can help make you a plan. Today I've got an example plan for you. Okay, now of course, in this example plan, some of these exercises may work for you and some won't. Okay, so I tried to make a general plan that could a little bit fit into everybody's box. So here's an example of what it would look like. Get on that recumbent cross trainer, one of my favorite exercise machines in the clinic. It's the New Step. Okay, do this 2 to 3 times a week, 10 to 30 minutes. Okay, so pick those days you'd like to do it. Head to the machine, jump on. If you get 10 minutes done, that's better than no minutes. All right, so the resistance training, again, 2 to 3 times a week, 1 to 2 sets of 10 reps each. Here, I've got some exercises for you. So if you're one of my patients, you've probably seen these. We've got the bridge, all-time favorite mat exercise, very stable position because you're laying down, and it works tons of things. It works your core, it works your legs, it works your butt. And if you're a lady in here, you're probably thinking, ooh, I want to shape that up. All right, then we've got the clamshell. So this man is laying on his side, his feet stay together, the knee comes up and down. Whatever movement you're doing, it should be slow and controlled. It's not about speed. It's not, oh, I got through it, cool, got my 10 minutes in. Take your time. Rest if you need it. Sit to stand is the next exercise, or squat taps, where your butt just touches the chair and then you stand right back up. Seated marches, and then eccentric training of the dorsiflexors. Okay, so you go up on 2 feet, down on 1 foot. So if you have foot drop, this would be a great exercise to perform. Okay, so all of these exercises here primarily focused on the glutes, the hips, and the lower extremities. Now let's look at flexibility. All right, so I've got some stretches here, kind of hits the whole body. Windshield wipers, wonderful for managing low back pain, helps loosen up the hips and the low back, where we all, almost everybody, whether you have MS or don't, hold tension. Child's pose, shoulder rolls, one of my all-time favorites all the time, right? Let's get a little massage in there. And then a calf stretch, so pushing up against the wall, trying to stretch that calf muscle. Now for the neuromotor. Okay, remember these are more complex. 3 to 6 times a week for 20 to 60 minutes. Okay, so this includes breathing. So we've got diaphragmatic breathing here, and then we've got complex movements incorporating balance and strength. The squats with the ball, extending it overhead, bird dogs, and balance. One additional practice that I haven't included in the exercise plan, but is extremely important, and which Jessica talked in detail about, is wellness and mindfulness. This practice is key. So maybe you're thinking, well, what exactly is wellness? It's practicing healthy habits daily to attain better physical and mental outcomes. This is so that you're not just surviving, but you're thriving. Mindfulness is being in the moment, being aware of how you feel, paying attention to your thoughts, to your feelings, not passing judgment on yourself for having those feelings. Tuning in to how you feel and how you're sensing things in the present moment. So how can you do that? You can use breathing, you can use light massage, progressive muscle relaxation, yoga, or Tai Chi. So here in the image, I've got progressive muscle relaxation. So it involves deep breathing, one of the other ones on our list. And you contract one area of your body for 5 seconds, and then you relax it. And then you move on to a different region and make it tight, and then relax it. So then you're actively creating tension in that region and then forcing it to relax. Some of you may be thinking, okay, this doesn't work, does it? But it actually does. It's going to reduce your stress. It's going to build strength. It's going to help you control your pain. And it's going to improve your sleep and decrease your blood pressure. All those things we need, right? Okay, so take some time for yourself. Include wellness and mindfulness into your daily practice. The easiest thing we can do, the easiest thing we have control of is our breathing. It's something you need no tools for. You don't need any equipment. You can do it anywhere. So take some time for yourself. Breathe in, breathe out, and how do you feel? So you're probably thinking, okay, she gave me a whole lot of information. Sorry, I usually teach college, so I throw out lots of information. But how can we focus all of this on maybe specific symptoms that you're experiencing? Those symptoms of MS that are really keeping you down. So let's look at specifics. So maybe you have fatigue. Maybe, your mood's not that great. Maybe you're tired a lot of the time. Well, you can use aerobic training. It's shown to reduce fatigue by more than 50%. That is a life changer. If you're feeling unstable when you're walking, you feel you have reduced mobility or weak, utilize resistance training to help with those areas. Maybe you have a lot of tension in your muscles. Maybe you experience lots of spasming in your legs. Utilize flexibility training to help calm those regions of your body, release that tension, and be able to move easier. Maybe your posture isn't as good as you'd like it to be. Maybe you don't feel very confident. Maybe you feel uncoordinated or you experience lots of falls. Neuromotor training is how you solve that problem. So you practice balance. You practice coordinated movements. And of course, you practice them in the safe environment. Maybe you have a spouse or a friend with you. Those are the ways to change these symptoms in your life, through exercise. If you get hot when you exercise, utilize cooling strategies for that heat intolerance. And whatever you do, protect yourself, be cautious, be safe. So as I'm coming to an end here, I just want to remind you that exercise is safe for you to do. You shouldn't be afraid of it. It doesn't have any known negative long-term side effects. It's not going to increase your risk of relapse. In fact, it will decrease your risk of relapse. It's neuroprotective, meaning that it's helping to heal your brain and spinal cord. And it's going to improve your brain function. So exercise will make you feel better. Exercise is medicine. So I've just got a few acknowledgments here. This all would not be possible with the support of my husband, Luke, and of our chickens. Their cuteness and their kindness and love for me abounds. And of course, my colleagues at both Georgia State and the Shepherd Center. Thank you, guys.
We thank you for everything you do, including your chickens.
They're very important.
Yes, you got to count your chickens before they hatch, right? I had to say that, I'm sorry. Does anybody out there have questions? All right, the first one online says, would 50 minutes of Aqua Fit 3 times per week cover cardio and resistance per week?
Yes.
Okay. Next one. I've always benefited from physical therapy after new lesions and or relapses. The most recent relapse had left me with a spastic hand and an increased numbness on both hands. Would going to a physical therapist benefit me?
Physical therapy, where I am at the Shepherd Center, focuses more on lower extremities and whole body. meaning like balance and coordination. So for an individual with upper extremity numbness, I would refer them to occupational therapy, where their focus is more upper extremity. But that falls still into, the exercise realm.
Okay, thank you for that. And Carol wants to say, I keep saying Carol all through today's program. Carol wants to say, great job. Okay,
thank you.
Good.
Appreciate that.
All right, next. So there are some people out there that feel, and I think it's the elliptical, where when you get onto this device and you're moving your legs, and then when they try to get off of it, they're totally have lost their balance, like as if their body is somewhere else before their feet hit the ground. What can you say to them?
For individuals that use the elliptical, please make sure you're safe. I can't emphasize it enough. I'm serious. Please be safe. If it's possible to set up a chair adjacent to the elliptical so that you can hold on to the rails, climb down to the chair, and take a seat until you feel stable again, that's what I would recommend for that patient or that individual.
Why does that happen?
Why does it happen? Well, I mean, I think it kind of happens to everybody. Like you get on the treadmill, you're walking, it's like the sides aren't moving like you would expect in a car. So your brain does some kind of convincing that you're moving because your legs are moving, but you're not actually going anywhere. And so you kind of get dizzy in that moment.
Okay. Next, because physical therapy requires a prescription, are there any reliable web resources, apps, or the like that, while not able to provide actual therapy sessions, can suggest exercises that are proven to be helpful for dealing with multiple sclerosis?
Yes, there are numerous websites and videos specifically designed for people with MS. Shepherd Center also has a telehealth program and a STEP program involving using telehealth to reach individuals that maybe are far out, maybe they don't have transportation to access exercise. They have live classes and they have videos. Highly recommend both of those. And then I also believe there's lifestyle videos on one of the, it's either like MSF or MNSS. Yeah, there we go.
And also Dr. Gretchen Hawley, who's CMSC certified. She's a physical therapist. She's always online on different programs, doing virtual, so if people want to find her, she's on the website. All right. Plus, there are plenty of other physical therapists and personal trainers that are out there that will work with you. All right. Next question online asks, how can you exercise when you cannot move your legs?
So I referred to this on the aerobic exercise slide. So there's FES cycling. Okay, so FES cycling stands for functional electrical stimulation. And so this is where electrical stimulation goes to the muscles and helps them contract when maybe your brain can't tell those muscles to contract anymore. And so that we can set you up on a cycle. You can also order these and have them shipped to you and set up into your home. So we put the little pads or electrodes on specific muscle groups related to bicycling, and then they stimulate in sequence to pedal the bike. Okay, this is really great. I've read a lot of research supporting this type of method of exercise for individuals that can't use their legs any longer as a method of improving their fitness and their health and their quality of life. So highly recommend FES cycling.
What are the insurance guidelines for physical therapy?
Insurance guidelines?
How many sessions?
I don't think that there's necessarily like a max number. I think that really depends on your insurance. Everybody's insurance is different. Most of my patients get 10 to 12 sessions in physical therapy. Shepherd Center has a wellness program that allows you to continue accessing the same tools that are available to patients as a wellness member, which is really wonderful. So then you can work out with other individuals that have MS and access some of that online training I told you about. Insurance is going to vary. So maybe they'll allow it for certain quarters of the year. Maybe it's only 10 for the whole year. And you know, while every single physical therapist would love to keep all their patients forever, there's not enough of us, right? So we have to limit it in some amount. So usually it's about 10 to 12 sessions, which is enough to provide enough education so that you can go home and keep practicing on your own.
Hi, I'm sorry. I was trying to get the name of that equipment you were saying. FES cycling?
Yep, FES cycling. Yeah, there's different brands out there. One's like Mile Cycle, I think that's what it's called. But if you search FES cycling, you should be able to see the different brands. And some of them are expensive. The cheaper version is just as good. Mm-hmm.
Hi, I wanted to know where you can find the breathing exercises because I did have speech therapy that dealt with my breathing a couple of years ago, and I can't find that information anymore. But I was just told my lungs were fine, but I do need to do more breathing exercises. So where am I going to find those?
Where are you going to find how to perform like diaphragmatic breathing?
Yeah.
So a simple Google search of diaphragmatic breathing. Harvard has a really wonderful site, as well as Johns Hopkins. So you can click on there and it will give you instructions with videos and images so that you can see exactly how to do it.
Not to say that she doesn't have internet, but what about for those that don't have internet?
Sure. So you could ask a friend that does have internet. Or if you are able to access a library, you could also go there and ask a librarian to help you with that search. Let's see. I'm sure that there's some informational handouts on breathing exercises as well at whatever wellness center you're currently attending, that they can help provide that for you.
I have a question about strengthening the anterior tib for foot drop. Is there any specific exercises that can be done, and should you just continue doing that every day so that you'll be okay?
Mm-hmm. Mm-hmm. Yeah. So I'm going to go back. So this exercise right here, so somebody is holding a resistance band and you're pulling your foot up. Okay, so there's that one. And I didn't say this, but you see the different colored bands in the top center. So yellow is the easiest and black is the hardest. So you can increase the intensity of the resistance as you get stronger. So then you keep progressing that exercise. And then if we go forward to my exercise plan, so in this bottom right corner, okay, so I know it's kind of small. I was trying to make it so we could fit everything on here. So you go up with 2 feet, and then whichever one is your weaker side, you stay on that one and you go down on that side. Super controlled. So up with 2, down with 1. Both of those will help. So this is eccentric training, meaning that you're working harder on what we call the down. If you think curl up, down, right? So that down motion is actually working you harder than the up motion. Does that answer your question? Okay.
I would like to take a ballroom dance class. My left side is weak, my weak side. Do you think this repetition of moves will help strengthen the muscles, help balance and coordination?
So that's kind of a hard question to answer because I don't know how well this person is moving right now.
In general, would it help a person to?
In general, yes. If, let's say, you're able to walk good distance and you start to experience that weakness after a good distance, ballroom dancing would be an excellent way to strengthen your legs and endurance. If, however, you start to experience issues with your balance and your foot continues to catch, I would take a break, step back, and then if you're able to keep participating, then keep going.
When we progress in our exercise regimens, like the more we do you recommend that we increase the amount of reps or the weight and the resistance, or does it matter?
Depending on the exercise, right? So if it's a banded exercise, you can increase the band intensity or resistance to challenge yourself to progress that exercise. If it's an exercise that has no weight, like the seated march that you see here, so it's the fourth one over, you could put ankle weights on, you could put a resistance band around the knees, increase that ankle weight over time. Any weighted exercise, you could increase the weight over time to progress it. When it comes to aerobic training, you can push yourself a little bit harder and be at more at the top of that rating of perceived exertion range. So we said 2 to 6 is a good place to be. If you're at 6, you could jump up a little bit to 7 or 8 occasionally to get that vigorous activity. It's not going to hurt you. But if you're feeling too fatigued from incorporating that, I would say step back and stay at the 6 and below. So really progressing the weight, the resistance, how hard you're working is going to help progress your fitness overall.
Okay. Any more questions here? Okay, we're finished. Thank you very much. Thank you again. Thank you. Have a great day, everybody, and drive carefully. Be well. Thank you.